as our hospitals and our facilities are getting reaching capacity, what happens is that we put people in a position that they're having to pick winners and losers.
At least in where I am right now, we have enough PPE, and we could always use some shortages with the remdesivir medication that seems to be working.
You're good on the steroid, good on the Pepcid.
Good on the steroid. Pepcid, yes. We are facing some shortages with Pepcid and remdesivir. Those are the two.
And remdesivir, okay.
Yeah. As plasma too?
Plasma. And plasma.
We know that the public doesn't trust what's going on. It's unfortunate.
Ask them to step into the hospital. They will believe.
But no, I think they believe that COVID is real, but I don't believe they believe all of the numbers.
We lost a dear friend and our partner. Him and I worked side by side, and he's only 54, Dr. Guzman. He was the residency program director, and we lost him. And it was really a tough day, and we had to move on. We had to show up, within 15-minute break, and then you got to go in and take care of the patients. And that was really hard yesterday working. And not just for me, but he has trained hundreds of doctors and most of our nurses, because we have about 100 of our nurses out sick right now. Because we have about 100 of our nurses out sick right now, and several of our doctors too. And we did receive 6 doctors from the state. They've been helping us deal with the additional census. We're holding steady. To me, in my personal opinion, we hit the peak, and we should see some improvement in the next few weeks. We're having a pandemic, the other emergencies don't stop. People continue to have strokes and continue to have MIs, and so we're still struggling with our census and stuff. But over the last couple of weeks, with our administrative help, we became really efficient in how to move the patients and stuff like that. And
for our little city of Corpus Christi compared to the New Yorks and the Houstons, you all sending the nurses. They just. I remember in one of our meetings, we made a request on Friday. The nurses showed up on Sunday, right? Wow. So thank you very much. And we'll continue this together and see what happens. That's all.
There's some kind of treatment out of Midland that they're using. Don't know what that is. Are y'all using different things other than the remdesivir? It's better than
I think what you're referring to is the budesonide nebulizer treatment.
Yeah.
That is a inhaled steroid. That would probably, in theory, work for mild cases. Mm-hmm. What I'm talking about, the treatment, is patients that are in the ICU or patients that are declining really fast. Budesonide, for those patients that are the pulse ox dropping and people having shortness of breath and getting hypoxic, budesonide alone won't work. Getting hypoxic, budesonide alone won't work. As a physician, again, that is a highly, highly contagious area. Even when I step in there, even with all my protective gear, I am scared.
It's a highly infective virus. So whether you're family or whether you're a close friend and all, it's the same rules that apply to everybody, even all of us too, as physicians for that matter. The more we wanted to see Dr. Guzman yesterday, all of us go and check on him, we were held by the standards of care and by, this is a contagion and you have to be very careful. So we also believe in some theories that the viral load plays a big factor. So if I may just give a small spiel to this, you're supposed to have about 15 minutes of unprotected exposure, which is about within the 6 feet distance from a patient, for you to have an exposure that is significant enough to cause the disease. So when you have two COVID patients in one room, yes, they are COVID patients. They probably can't give it to each other, but the amount of exposure we will have as clinicians and nurses and technicians going into that room is also not advisable. Thank God, thanks to you all and the judge and several emergency managers, we have not reached that crisis to where we have to keep two patients in one room yet. But our advice, and Dr. Papnini, please correct me if I'm wrong, but my advice is not to put two patients in one room, even if they're husband and wife.
But then you got to get yourself together. You got to go in and, every day we get up and I know the risk. I could get infected and there is a very good chance I'm going to bring it home and to my family. So the situation is very scary. 2 weeks ago, it was even worse, and things are much, much more organized now. Thanks to HCA being the huge organization in this country, they helped us immensely, pouring resources and educational materials and daily conferences and changing treatments and stuff. But yes, it is scary, and every critical care doctor in our hospital, we can see it in their faces.
Thank you, Doctor.
But we just have to do what we have to do.
But I don't want to leave this court without deeply thanking our judge and you all commissioners and Governor Abbott. I mean, without you all, it would have been very difficult. We